The overall care here has been tremendous. I think, in the United States they were talking about sending me home on the third day or thereabouts from the hip surgery, and looking back on it, I think that was just too early. It's nice to be able to stay, in my case, and get the constant attention of the nurses and doctors and the physical therapy people. They give you the opportunity to walk, and they teach you how to walk, and they work with you, and they take you through exercises that are important to get started. And so all that is just very good care, and then all your medicines that are needed to get going, and they just monitor you very well, and a lot of personal attention, and that's something that I think is just not available in the United States, because it is much more expensive to have that kind of labor and care as part of the service. And Dr. Bose, again, was just wonderful. He takes the time to answer your questions thoroughly, and what I like too is that it wasn't just whatever you want done. It's like the United States, the surgeon was, he didn't spend that much time with me, and he was more of if you want this done, fine. If you want your second hip done, that's fine, we can do that too, But Dr. Bose, he went into a little more detail of pros and cons for doing things, and he was not afraid to give his own opinion, of course, and it's a very good opinion, and one that I wanted to listen to as far as what he might recommend. And so I just felt like he was giving me very experienced and well thought through answers, and I was able to interview with him long distance previous to coming here, after he'd been forwarded my x-rays from the States. Wouter set up a conference call interview with Dr. Bose, and I was just very happy with some of the things he had to say about what to expect, and how even the pain in my other leg, which I thought might require a bilateral hip replacement, a lot of that would subside, because it looked like it should be good for a good while yet. And so I was very encouraged and very pleased to be able to have that conversation with Dr. Bose prior to the surgery. And the nurses, the care here is just very nice. They are very attentive. They come instantly if you call them on the line, from your bed, your hospital room. If you need something, they're quick to come, and they're very very friendly. Everybody here smiles beautifully. It's very nice all around. And the room is very spacious. There's a place for my wife to keep her things. We had more luggage probably than we needed or should have brought to begin with, and yet we were able to store it all quite well. And she had a nice little bed to stay in, and there's a table, and we could access the internet and do the email and Skype calling, and the people here, Mohan is very expert at helping with computers. And so it's just like everything is taken care of that you need. You do spend a lot of time in the bed, so be prepared to be on your backside, and maybe some kind of donut-sized pillow cushion would be good to help yourself deal with being in the bed a lot. But that's only for the first few days, and then you're up on your feet also. So anyway, it's just a good experience.